If your lower back burns, or if a sharp, hot pain shoots down your leg every single night when you try to rest, please stop reaching for temporary pain pills. Those pills only mask the problem by numbing your body's natural alarm system, but they completely fail to turn off the fire at the source. Tonight, before you turn off the lights, dedicate just a few minutes to a simple, gentle movement sequence right on top of your mattress. There is no need for heavy equipment, no need to get down on the hard floor, and absolutely no sweating required. This routine targets the exact structural root cause of your sciatica, giving your trapped nerve the immediate space it desperately needs to breathe, allowing you to finally experience a full night of deep, uninterrupted sleep. To understand why this bedtime routine is so effective, we have to look closely at what is actually happening deep inside your lower back. As we get older, the spongy spaces between our spinal discs can naturally begin to narrow and dehydrate due to years of daily wear and tear. When these disc spaces compress, the sciatic nerve, which happens to be the longest and thickest nerve in your entire body, gets pinched and irritated like a kinked garden hose. Because this massive nerve pathway originates in your lower spine and travels all the way down to your feet. Any irritation at the top sends a severe distress signal down the line. This is exactly why you experience that agonizing sensation of hot electricity, a deep throb in your glutes, or a sudden shock running down your hamstring. The single biggest mistake most people make when they feel this tightness is trying to aggressively stretch the leg or lower back out. They pull their legs as hard as they can, thinking they can force the muscle to loosen up. However, an irritated nerve is an inflamed nerve, and a nerve reacts to aggressive pulling by doing the exact opposite of what you want. It perceives the harsh stretch as a threat, causing the surrounding muscles to violently spasm and tighten up even more to protect the area. What your body actually needs is a therapeutic method called nerve flossing. Instead of pulling the nerve taut, we are going to gently slide it back and forth through the tight muscles, releasing the physical entrapment without triggering a painful response. Let us begin this gentle sequence together right now. Right where you are on your bed, lie completely flat on your back. Let your shoulders drop heavily into the mattress, and let go of all the tension you accumulated throughout the day. We will start with the first movement, the gentle knee to chest. This specific position is designed to open up the lumbar spine and decompress the lower vertebrae. Slowly bend your painful leg, keeping your foot resting lightly on the surface of the bed. Take both of your hands and clasp your fingers firmly behind your thigh, right in the space behind your knee. It is incredibly important that you never place your hands over the top of the kneecap to protect your joint from unnecessary pressure. Now, gently draw your knee up toward your chest. Only move as far as your body naturally allows, stopping the very moment you feel a light, comfortable release. Hold this position steady for 30 seconds. Focus all of your awareness on your breathing, taking long, slow inhalations through your nose and deep exhalations through your mouth. Feel your lower back widening and flattening safely against the support of your mattress. Slowly and carefully lower your leg back down. Now, we will transition into the second movement, the reclined pigeon glide. This posture is specifically engineered to target the deep hip stabilizers that often entrap the sciatic nerve further down the pathway. Begin by bending both of your knees, placing both of your feet flat on the bed. Take the ankle of your painful leg, lift it up, and rest it comfortably across the opposite knee, forming the shape of a figure 4. Take the palm of your hand and place it gently against the inside of your raised knee. Very slowly, exert a light, steady pressure to push that knee away from your torso. This precise angle directly targets and releases the piriformis muscle located deep within the glutes. Because the sciatic nerve runs directly underneath this muscle, a tight hip will literally strangle it. Hold this gentle pressure for 30 seconds while maintaining a calm, steady breathing rhythm. Slowly release the hand pressure, uncross your ankle, and return both feet flat to the bed. Next, we move into the third and final movement, sciatic nerve flossing. This is the dynamic component of the routine that physically slides the nerve through its pathways to break up internal friction. Lift your painful legs slightly off the bed, keeping your knee bent at a 90-degree angle, and support the weight of your leg by gripping the back of your thigh with both hands. Now, slowly point your toes up toward the ceiling, straightening your leg only to the point where you feel a very light tug. Never lock your knee out completely. Once you feel that light tension, slowly lower your foot back down while simultaneously pulling your toes up toward your face. Continue this alternating motion up and down. This rhythmic motion acts exactly like dental floss. And completely relax. Now that you have successfully completed these 3 movements, there is one final vital safety tip you must implement every single morning. When you wake up, you must never sit straight up out of bed like a sit-up, as this action places a massive compressive load directly onto your lumbar spine. Instead, always roll your entire body completely onto your side first. Allow your legs to swing out over the edge of the mattress, and use the strength of your arms to push your upper body sideways into a seated position. This simple habit keeps your spine perfectly aligned and protects your nerve from sudden re-injury. Practice this exact routine every single night right before you turn off the lights. Consistency is the true key to nerve recovery, and over the course of the next 2 weeks, you will begin to notice an incredible shift as that burning sensation starts to retreat out of your leg, moves back up into your hip, and eventually fades away entirely. Turn off your lights, sink deep into your mattress, breathe peacefully, and sleep exceptionally well tonight. If this routine brought you comfort, please remember to subscribe and like for more daily health tips, and I look forward to seeing you tomorrow.